that has been set up. And let's talk about this facility, because I see it's also in memory of Asima Moosa and Muhammad Sadiq Davids.
Okay, so just to give you a little background on the memory bit, Asima Moosa is like a brother to me. Was my husband's best friend, and he lost his life to COVID-19 this year. Muhammad Sadiq Davids was one of the bio members for FMYO, and he also lost his life to COVID-19. So when we set this up, it just seemed appropriate to honor them with the facility. Basically, how Helen Joseph started was, I had the medical supplies division for FMYO, and we loan out oxygen concentrators. And often in our field, when we are loaning out machines, our patients rarely end up in hospital. And we try to focus on people that don't have access to healthcare. And so we rely a lot on the government facilities. And when Charlotte burnt, that's Joburg Gen, the crippling effect on the rest of the public sector was, I can't even explain to it. There were patients, probably about 50 or 60 a day, sitting outside emergency departments that haven't even been triaged yet. And we would get notification of this from the people that we've had originally given a concentrator to, or were looking for a concentrator and needed to come home because they're sitting there struggling to breathe but can't get the health care that they need. And it's no fault of the government. It's that a massive facility was shut down and COVID-19 was out of control in Gauteng. Well, it still is. So these people are sitting there and the hospital just can't cope. There's no beds, there's no access. And I got in touch with my cousin Asima Moosa from Wooloton because they set up an organization called Muslims for Humanity. And through the second wave in KZN, they experienced similar to what we're going through right now. They set up these triage units outside Ahmed Al-Qadi and I think one hospital in Fordsburg, I forget the name. So when I called him, he said to me that they were definitely on board. I spoke to Imran Juma from NMJ and I spoke to Yasir Suleiman from the Caring Sisters Network. And then on FMY's medical review team, we have Dr. Hussein Pahad, Dr. Asima Moosa, and Dr. Shoaib Wadi. Shoaib Wadi is with IMA. So he facilitated the introductions to the key staff at Helen Joseph. I must be honest, right at the outset, everybody said to me, you're going into the public sector, you're going to deal with tons of red tape. You're never going to get this facility off the ground. And for us, the problem was we needed to help the people with no access to healthcare. Putting this facility up in a hospital like one of the med cares or one of the mediclinics would have been a lot easier because it's easier to access the senior staff and there's no red tape effectively because you don't have to run everything by government. But the problem was it wasn't going to help the people that we needed to get the help to. To cut a long story short, we met with Dr. Morisani and Dr. Chow, who's the CEO of Helen Joseph. We proposed the tent structure to them. And knowing what they were going through at the hospital, they were glad to help immediately. And with Charlotte being closed, there was access to staff, there was access to beds, there was access to things that they could bring in from the medical side. And alhamdulillah, we started. It took a month to get off the ground, but it's open and it's really helping the pressure on the emergency department.
Well, it certainly is because, again, I've just had a look at the tweet and I've looked at the inside of the tent and looking at this facility and how it's basically been set up. And it's actually encouraging to see organizations like the FYMO, getting involved. And we see this with many other organizations as well coming through. And this is the type of support that is needed, but also at the same time in terms of showing solidarity with people who have been infected with the virus. And as you mentioned, Asima, those that have absolutely no access whatsoever to private healthcare. And I think this is most encouraging to see how people have actually rallied together to try and do their best in these very, very difficult times.
Absolutely. We also got support from Investec Bank. I called the CSI set and he was totally on board. We got support from the CSI Pearl, from Standard Bank. So they also contributed to the project. So the support has been overwhelming. And I think seeing what's happening in Gauteng has made it easier for people to put their hands in their pockets and people that have the ability to assist, because really, what else can you do? You try the best that you can. And it's very disconcerting to hear people on the other end of the phone. I mean, our volunteers get between 40 to 50 phone calls a day. There was at a point last week the week before, when not a single organization in Gauteng had a single oxygen concentrator left. And we were in a position that we placed an order 2 weeks prior to that, and Emirates kept canceling our flights because our courier wasn't arriving. On Sunday evening, last Sunday, for the first time, FMYO was out of machines, and actually sent out a notice to the public saying, please make dua that our machines arrive tomorrow, because if they don't, I actually don't know what we're going to do. I said, I'm going to switch my phone off, because how do you deal with a family that is crying and literally crying on the other end of the phone, saying to you, my mother or my brother, or my sister or my father can't breathe, I need a machine, and I can't get into hospital, and we have nothing left. Alhamdulillah, by the grace of Almighty Allah, on Monday, all those machines arrived, and we sent out a notice saying we're back in business. Not that it is a business, but just the analogy that we use. And Joburg has been, I've never, we went through the first and second wave, and I really thought we had it hard then, but I could never have comprehended what is happening right now. We're really in uncharted waters. You dropping off machines to families, and then 2 days later you get a phone call, say, please collect, my mom's died, my dad's passed away. Families are just getting wiped out. It's frightening. It really, really is frightening.
Well, certainly it is frightening, but alhamdulillah, with organizations like yourself, with people like yourself, and all who have been involved, the medical personnel, the corporates that are supporting this initiative, inshallah, it's just making life a bit more easier for people, and Allah subhanahu wa ta'ala accept, Allah reward your efforts, Asima. And, I think from time to time, obviously, we will have to touch base to see how we are going. We know that we are in a very, very critical situation at this point in time. And all we can do is do our best to assist whoever we can. And at the same time, continue making dua to Allah subhanahu wa ta'ala to grant us ease during these critical times, Asima.
Jazakallah for having us on your show.
Jazakallah to you as well for coming on. Have yourself a wonderful Jummah, inshallah. And all the best to you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Asima Moosa joining us this morning, the FMYO, the Fordsburg Muslim Youth Organization COVID-19 support facility out at the Helen Joseph Hospital. When we come back, we'll be joined by Sheikh Zakir Hussain, the editor at the Cognate. We're talking about the Modi government. We're talking about Modi, obviously, as far as his cabinet is concerned, making massive changes to his cabinet. And this includes the Minister of Health at a critical time when the virus is creating havoc.
What makes Randri Jewellers the optimum place for your memorable gift? Is it our range of exclusive, high-end, luxurious jewellery? Or is it our master craftsmanship of all your bespoke jewellery needs? We believe it's because at Randri Jewellers, we know just how to make your special moment